Hi, this is Eric Wookie. I was going to give a quick nursing documentation primer. Once you log in, you'll first be asked to select which facility you're working at, and we're just going to use West 7th. This is a demo account. And so this dashboard screen would show you the volume for the facility that you're at. And then if we go to the chart icon, that will take us to the active board. And we're going to use Darth Vader. Darth Vader is highlighted in yellow, meaning this patient is ready for discharge. You can see the little pencil icon, and Darth Vader has something in red. So if you click the red one, these are notes just for communication with the team, not something that's part of the chart. And you can add a comment if you'd like to put that in there. Things could be stuff like the patient is in a pain management program, please call this doctor, etc. So I'm going to then click on Darth Vader. You can basically click anywhere on that line. So you can click his name or his chief complaint or anything like that, and it'll bring him up. And so for the nurse here, you can see on the left-hand side, we've got vitals. So we could put in a set of vitals. So let's say he's 190 over 100. This was on the right side. He was supine. Pulse was 88. Respirations were 20. O2 sat was 95%, and this was on room air. Temperature, let's say he's 99.8, and this was oral. Pain scale, let's say he's got a 3. And then you hit the little plus icon here to then record that. And if you made a mistake, you can click on the chart icon again and make your corrections and do the checkbox, and they'll correct anything that's done. Below vitals over here on the left again, there's a nursing. And from here we can say, all right, triage time. We can put in a triage narrative. This can be any text that you would like. On the live system, you'll see a little red icon. You can click that for voice recognition. The triage assessment, we're going to say the airway is within normal limits, breathing is within normal limits, circulation within normal, GCS is 15. Let's say the patient was having a little labored breathing, so we're going to change from within normal limits to a red line through it. We're going to say breathing labored. Triage level, we're going to say this is life-threatening. This is a shortness of breath in a 70-year-old male. Here's some outbreak screening. I had already answered these negatively. You could put in the height and weight here. Again, this is in inches, not feet and inches, so you have to calculate total inches. And so Darth Vader's pretty tall. So 6 foot, 6 times 12 is about 72. So let's say he's about 76 inches tall. And he's pretty heavy because he's got all that robotic stuff on him. So let's give him about 240 pounds. And then again, hit the plus icon, and that'll record that. We're going to say call height within reach. Bed was in locked position. Family and friends. So basically, we're going to say all these are yes. Nursing note. So from here, you can say you could say reassessed, or that the nasal swab was collected. So that can be added. And then on departure, you can put in specific notes for departure. A lot of these are kind of sort of memorized notes, DCC instructions given, etc. Under medical history, never mind. I had something that I put in that I did not record. Oh, that's here. So never mind. I'm all good. I'm going to skip that. Under medical history, there's some information about his medications and allergies, etc. You can put in preferred pharmacy. And under past medical history, I'm going to say COPD. Again, have to hit the plus icon. He had, so I'm going to say bilateral BKA. Hit the plus icon. On our family history, you can do the same thing. Tobacco history, we're going to say never. Alcohol use, none. Marijuana, no. Amphetamine, no. Heroin, no. Now, the physician will then document under HPI and exam, etc. Under orders, if there are orders that need to be started or completed, you can go here to then put information. So I'm going to say patient place pulse oxygenation. I'm going to do a little check box here saying that was started. So the little check marks means that this order was started. Was placed on monitors, EKG. We're going to say, instead of starting the aspirin, we're just going to do it. So I'm going to hit the little chart icon on the aspirin. So I'm going to say PO med given. Response to medication, we're going to say no adverse reaction. I'm going to check the box for order completed and then hit save. Now that order is done, we're going to do the same thing for IV placement. I'm going to click the chart icon. I'm going to say this was in the right AC, and it was a 18 gauge. I'm going to say blood was drawn, a saline lock was applied, tegaderm, and the IV secured. Again, order completed, and hit save. And so that's how you can put in orders. Stuff that started, like pulse oximetry, there's really nothing else to add here, so we're just going to put it in a comment and say applied to finger, and hit save. If there's, here's a urinalysis, and let's say typically the tech will put in the results, but if you want to put in results, again, you can just click the chart icon on the urinalysis and say urine was collected via a void. Color was normal, let's say light yellow. It was clear. Glucose was 100. Bilirubin was negative. Ketones, we're going to say small. Specific gravity was 1.15. Negative for blood. pH was 6.5. There was some protein. There was 2+ protein. There was negative nitrate, negative leukocyte esterase. That order is then completed, and all those results are now in. One thing I'll show you real quick also, I'm just going to click the chart icon on the EKG, hand it to physician. Right here there's a camera icon. If you click the camera icon, you can actually take a picture of the EKG and have that visible. And then let's say we've put in all of our orders, we've put in all of our notes. We're ready to help get the patient out of here. The patient was highlighted yellow, if you remember, saying ready for discharge. We've now completed our nursing documentation. We go to disposition. And before we can get this patient out of here, we're going to have to say what time that they left. You can click now, or if they left a few minutes ago, we can say they left at 12:40. So you are not able to discharge the patient out of the system until you put a time the patient left the emergency room, and then you just click ready for discharge. This patient's been here for a long time because it's a test patient, but we're good with this. We're going to say okay. And now when we go back to our charting, room 1 is empty. Darth Vader has been taken off the board. So that's a very quick primer for nursing documentation, and hopefully you can pick it up pretty quick. Thank you.